Well, we got a lot to cover in a short amount of time. I usually don't get too nervous about these talks, but I usually get about an hour to talk, and I'm going to give you guys as much as I can in about 15 minutes. So anyway, thanks everybody for coming. We appreciate it. Some of you have actually seen before, so hello again. But what we'll try and do is just do a brief overview real quick of kind of concussion, where it sort of stands. And really the practical thing, I think, for a lot of the athletes in the room is sort of how do we kind of decide, how we're going to clear you, how does that process work, what kind of things should you do if you do get a concussion. So we'll kind of move forward here. My first slide is just, I figure you got to start with a definition. And if we want to get really complex, we can say any direct or indirect force applied to the head or body, doesn't have to be the head, that causes intracranial movement of the brain and results in a complex vascular, neurochemical, and processing injuries resulting in concussive symptoms. So that's kind of a complex definition, kind of hard to talk and say. I always tell people, think about these a lot more simply. If you have a force applied to the body, following which you get symptoms consistent with a concussion, it's really a concussion till proven otherwise. It's not always a concussion. That's why we have trained people like the trainers and the medical staff and hopefully your coaches and things to know this stuff. But in general, those, when we see this force applied that's consistent with possibly causing a concussion, symptoms consistent with a concussion, we want to treat that as a concussion until we're sure it's not, or until it's resolved. So in case anybody here is really into chemistry and good stuff like that, I will put one slide in here only with a graph. This is kind of an oldie but goodie if anybody's into chemistry. But basically there's a lot of changes that take place in the brain. And really the important thing that I want you guys to know is not so much what all those things are up on the screen there, but sort of this thing in the bottom down here. And it's a timeline that goes from minutes to hours to days. And what you can see is there's some things out here that really are clearing up out about the 10th day, okay? So even though symptoms may not last that long, we know that there's still some changes going on in the brain out till that point. Really what those things are is cerebral blood flow changes and also cerebral metabolic rate and glucose utilization. So those are changes that take place in the brain more than a few days, even if you have symptoms. So oftentimes it's sort of on the earliest end of things that we'll target towards getting people back towards the end of that process. So what kind of statistics are out there? Well, just recently, the American Academy of Pediatrics, that's what that stands for, said there's as many as 1.9 million concussions in the US yearly under the age of 18. That's a lot of injuries. So what kind of things have we seen? Well, there's been about a 500% increase in the diagnosis of concussion in children and young adults since 2010. Why that's important, it's not that we're getting more injuries, it's probably that we're recognizing these more and hopefully getting them treated so that we're not dealing with the consequences of the concussions as much. So it's not a bad statistic, it's actually a statistic that says that we're better at identifying these. Last thing on here, boys tend to have a higher incidence of concussion than girls. But if you look at similar sports, so if you look at states where certain girl sports such as field and ice hockey, lacrosse, and soccer occur, those states it's actually equal. So this is not really a bigger boys problem or a girls problem. And actually in some other statistics, some of the girl sports have overtaken some of the boys sports in terms of the number of concussions out there. So what is a general concussion? Well, it's usually a 1 to 4 week kind of process, probably in about 70 to 80% of the cases. There has been some recent stuff about what are called vestibular ocular symptoms, meaning really fine abnormalities of the visual system and the balance system. Some of those they can actually find relatively consistently out to 3 to 4 weeks. So probably, even though someone feels good at a week, we could probably prove if we wanted there's still some things going on. Oftentimes we don't wait that long to get people back, but we definitely want to look for those changes. Symptoms can last for months to years. We call that a post-concussion syndrome. So really, if you clear up in that first 4 weeks or even 2 months, we just kind of call it a concussion. But as things seem to go longer, we kind of change the name to a post-concussive syndrome, meaning the acute concussion is resolved, but we're seeing ongoing symptoms. The important thing here too is that some of these can be catastrophic. One of the things that we worry about and why we have state laws is you can actually die from a concussion. And I'm not talking about a massive brain injury. I'm talking about from a concussion. And that's in something called second impact syndrome. These things occur when the brain actually is injured and gets re-injured, and I'll talk about that in a subsequent slide. But that's what we're trying to prevent. That's why the laws exist. There's no laws about your knee. So, if I treat your knee and I tell you you're fine and you go out and it's not, I'm not a good doctor, but on the other hand, I'm not breaking any public laws. In Idaho, there's actually an Idaho state law for this. So the onset, type, and severity of symptoms can vary widely, and importantly, no two are alike. Therefore, we should treat everybody individually. So if your friend got better in a week, it doesn't mean you're going to get better in a week. If your friend got better in a month, it doesn't mean yours is going to take a month. Sometimes people have a lot of problems with headaches. Some people have more problems cognitively. Some people have problems with a lot of things. So anyway, concussion entry-level sports. I tried to throw occasionally some slides in here to at least get people smiling. So this is one out of a newspaper not too long ago. He's still learning the game, hasn't even had his first concussion. So importance of identification of concussion. Athletes are at risk for much more severe injury or prolonged recovery if these aren't treated appropriately. We talked about the really bad thing, and that would be like a second impact. But honestly, if you still have a concussion and you continue to play, or you go out and get injured a second time before that one's cleared up, you could have much worse symptoms for a much longer period of time. It's a major cause of both long and short-term disability, and that's not only in adults but kids too. And there may be relationships to dementia and neurologic problems later in life. Now, that's up there. These are things we don't completely understand. Modern concussion care really started about 2004. So if you take those kids that we treated in 2004 and move forward, we're 2018, we only know about 14 years of how they're going to do. So we're hoping that the things that we're doing are going to reduce these statistics. But we do know, and people see it in football all the time, that if people have repeated concussions and injuries, I don't know if anybody's seen Jim McMahon, the quarterback of the Bears, some of these people from these repeated injuries have some really long-term complications. So we're trying to treat these well so we hopefully avoid those things. They can cause short and long-term psychological changes. So oftentimes we'll hear, since a concussion, they're irritable, grumpy, things like that. Those are things we want to try and address. So here's another thing relating to age and how long out we're talking here. It says, remember the good old days when we played sports and never worried if we got concussions? And of course the guy on the bench says no. So anyway, sometimes it's really easy to figure these things out, right? Somebody gets hit, they fall over, they're wobbling, they go to the wrong huddle, they're standing there looking around. Maybe they're laying unconscious. So sometimes it's easy to kind of pick them up. And the big problem is oftentimes it's not. I don't know if anybody remembers Gary Larson, who used to do The Far Side, but this is basically moods of an Irish setter. And as you notice, you can't tell much about Irish setters by their appearance. So anyway. So what kind of signs are we looking for? What are the athletes what are we seeing in the athletes if like we're a parent or a coach or someone on the sideline? We're looking, do they look dazed or stunned? Are they moving clumsily around the field or wherever they're participating? Are they answering questions slowly, not as quickly as they might? Obviously, if they lose consciousness, that's a big one. That's not subtle. Usually lots of people will know that one. Are they showing behavior or personality changes? I mean, occasionally we'll have somebody just starts crying or gets really angry and screaming and not the kid that we think he is. They sometimes can't recall what happened prior to the hit or fall. They may ask lots of questions about it. And then again, obviously before or after, sometimes they can be confused. So what are the athletes reporting? When they're getting concussions, what are they telling their trainers or their coaches, their doctors or their parents? Well, they might have a headache or pressure in their head. Sometimes nausea and vomiting is part of the equation. They may have balance problems or dizziness. Again, you might see them, they might say it's hard for me to walk. Double or blurry vision or problems with their vision in general. Sensitivity to light or noise. So if they're in the room doing this and sometimes that's a sign that something might have happened. They might feel sluggish, hazy, foggy, or groggy. And again, concentration or memory problems. They may not be able to tell you kind of what's been going on. They just don't feel right. Interestingly, that's sometimes what we hear. I just don't feel right. I just don't feel right. And obviously confusion. If they don't know quite what they're doing, that's a problem. So The sports world has done about 4 international symposiums on concussion in sport, and they've tried to come up with some general guidelines. And so I just kind of summarize them in a couple of slides about where that all is. There's a lot to it. If you're ever bored and want to read, there's, actually it's some decent reading. But the main thing that came out really early and is kind of held forever is when in doubt, sit them out. Again, the consequences of not treating a concussion can be severe. So if there's a question, have them sit out. We can always figure it out in a little bit. But again, we risk a lot if we put them back and there's something going on. So another thing that came out in those guidelines, no athlete should play with symptoms either at rest or with exertion. If they have neurocognitive testing, and in our schools we use impact testing, that should return to normal before they should be cleared for activity. A youth athlete, this is one of the later ones, a youth athlete should never be returned to sport the same day of a concussion, no matter how brief the duration of symptoms. So if your child is confused for 5-10 minutes or feels unsteady or kind of doesn't know what they're doing, but it all clears, that's a good sign. We're glad it's happening, but it doesn't mean they should go back and risk another injury quite yet. And part of the reason is that sometimes there's a delay in the true onset of symptoms. Sometimes we'll see the subtle symptoms up front, and then they'll go home that night, and that's when the headache will start. Or the next morning they wake up, that's when they can't go to school and they're throwing up. Never trying to get them back until we know that we've cleared that kind of risky area where symptoms may be there. Every injury and athlete are different, and there's no standard timeline or grading system that predicts recovery. So if someone says to you, oh, they had a grade 2 concussion, they probably were trained in concussion about 20 years ago now. So again, we really look at things as either simple or complex, and that's kind of how we rate concussions. So this top piece up here, no child should return to sport before returning successfully to the classroom. This came out of the Zurich 2012 meetings. Basically what's important there is the Idaho law and general concussion consensus is that we don't have children go back to playing sports, especially contact sports, until they're back to doing how they were doing prior to the injury in the classroom. It's called the return to learn part of the law, and it's actually part of the Idaho state law. So if a child was getting A's or B's prior to the injury and handling all their schoolwork with no problem, they should be doing that again before they return to play. So that's going to be a question that you guys are going to get asked by your providers. Concussion modifiers should dictate even more conservative decision-making in children and adolescents. So things that we always look at, how many concussions have they had? How long did those concussions last? How severe were the symptoms? Did they have really severe symptoms that kept them out of school for a while? Not only the history of a number of concussions, but also how close were they? Did they have another one a month ago, or you've had 3 in the last year? And what's the threshold? One of the things we always worry about is sometimes after several concussions, it takes less to give you a concussion. And sometimes one of the warning signs we hear is like, yeah, I got hit, but I really didn't think that was going to give me a concussion. I didn't get hit that hard. That's actually a concern, because it means, again, the threshold for getting that injury has gone down, and that's someone we might need to be conservative with and definitely make sure we get them to recover. Sometimes where that becomes a problem, we actually will go for an extended period of time to kind of hold until they've had some healthy brain time to return to sports. Doesn't mean they can't, but it means we want to make sure they're doing good. Certainly loss of consciousness over a minute is concerning. Any significant amnesia beyond kind of like what happened, if they're having amnesia to important things. I've seen it all the way to complete global amnesia before. Any history of migraines, depression, or any mental health disorders can certainly cause longer symptoms. ADD and ADHD, those kids tend to have a little harder time getting back into school and getting back to that baseline. Obviously any learning disabilities or even sleep disorders are a big problem. Certainly the style of play, the level of the sport, if you're going back to football, that's going to be a different probably set of thought processes than if you're going back to the golf team. So anyway, other quick things, decision making should be the same for elite and non-elite athletes. So if you've got a kid in junior tackle, we should be treating him the same way that we're going to treat our kids in high school, that we're going to treat kids in college, that I'm going to treat kids on the Olympic ski team. So we don't distinguish the level in terms of treating these. Every person with a concussion deserves to be getting the full treatment. So People may have heard of CTE. That's something that the NFL is dealing with. It's chronic traumatic encephalopathy. That's the football player's disease that you hear about with pro football. Honestly, we don't know, even with all the data and information going into it and research, we don't know exactly why it happens. It happens only in certain sports. It doesn't happen in people who didn't have repetitive injury. Intriguingly, it doesn't seem to happen just because of a concussion or two. It seems to be those repetitive injuries, repetitive contacts that cause the problem, as far as we can tell. Anyway, protective equipment, helmets, mouth guards have not been shown to reduce concussions, but can reduce other traumatic injuries. If you're a parent out there, make sure your kid has good fitting, good equipment. You know, if you are wearing a football helmet and you're standing on this hard floor and you fall and hit your head, you may still get a concussion, but hopefully you don't get a big goose egg laceration or skull fracture. So these things do have important use, but it doesn't mean because you have a good helmet you're not going to get a concussion. Right now, nobody's been able to prove, with all the research and everything done, that we've actually reduced that risk yet. Rule changes may be necessary. I don't know how many soccer players we have here, but you guys may know that there's recommendations now not to head until you get to junior high or high school level. So we're kind of making some changes to try and help things. It turns out, for example, in soccer that about 50% of concussions in soccer are related to the act of heading, not hitting the ball, but going to head the ball and heading someone else's head, or someone's elbow hits you, or you get cut out from under you and you're laying on the ground hitting your head there. So anyway, so anything you can do to reduce these risks, we talk about doing. So this one says, why science teachers should not be given playground duty. I don't know if you guys get those toys anymore, but when I was young, everybody had one of those things where you drop the ball and the other side goes up and it comes back. So what's the basic treatment? I always talk about neurocognitive and physical rest for people. I'm just going to quickly run through this. No video games, guys. That's one of my rules. It's about as much stress as I can put on your brain. It's probably worse than a calculus test. So it's a lot of data for your brain to be processing very quickly. I've had literally pro-level athletes go backwards because a new video game came out and they thought they were going to be okay playing. And it took them several weeks longer to recover. Limit television and computer time, decrease social media and texting, decrease environmental stimulus such as bright lights and loud noises. Sleep is really essential, and you'll get a talk about that coming up from Dr. Bean. 8 to 9 hours of quality sleep. Be consistent in your sleep schedule. We do academic accommodations if kids are in school. Make sure you're eating healthy if you can, 3 meals daily. Keep healthy snacks around. Stay well hydrated. And I usually, and have been for a long time, but this is actually now an official recommendation that's been advocated by the American Academy of Pediatrics. Light exertion such as walking, riding a stationary bike, or even swimming, as long as you keep your heart rate down and are not doing anything dangerous. So that means if you're swimming, you're not doing chicken fights or whatever. But that can actually, once you get past the initial severe symptoms, can really help recovery. So we try not to get kids watching reruns of Oprah. No PE or sports until things recover. Obviously, no activities which can risk re-injury. So obviously, we don't want adults or kids on ladders or riding their bike. We see a lot of concussions from riding bikes and having accidents. So you want to stay away from those things. Again, you're really trying to avoid that repeat injury. Caution with driving. If you're of driving age, it's a lot of multitasking when you drive. I prescribe or give people a list of some supplements and vitamins that can sometimes help ease some of the symptoms. If I can stay away from prescriptives, I do it. Although on MD, sometimes I do have to use prescriptions. If we do use prescriptions, an athlete should not return to sport if they're needed to reduce symptoms. In other words, if you're put on a prescriptive medicine to help you sleep because you can't sleep and that wasn't a problem before the injury, or to get your headaches down, you got to be really off that before we can get you back to sports. In most cases, anyway. Many other therapies are often used. Oftentimes we'll use some complementary things to try and get people better. If you have neck pain, work on physical therapy. So this is actually a real live concussion picture, not just a picture I put birds on. The birds actually weren't there, but this is my youngest son, who's now actually in high school. But he was home with a concussion after having a collision on the ski racing course with his 220-pound coach. So we kind of went through that. And actually, I was really uncomfortable clearing him. I had a coworker or another physician clear him because I didn't trust myself. But anyway, Here's an academic accommodations prescription. It kind of goes through a lot of different things that we can provide for our athletes while they're in school to help ease the load a little bit. So we make sure that the kids have that if it's necessary. We talked about second impact syndrome just quickly. It's thought to occur when an athlete sustains a concussion, continues in or returns to participation in contact sports before full healing has occurred. The athlete then receives a second direct or indirect impact, meaning it doesn't always have to be a hit in the head. It can even be mild in nature. It's believed that the injured brain can lose its ability to auto-regulate, and it suddenly begins to swell up and can't control that. If the brain swells, it's in a very enclosed space, so at some point the pressure inside the skull gets greater than the blood pressure, and so literally you can lose blood flow. The brain can actually try and escape out the bottom of the skull, and in most cases it ends in death. So this is a really bad thing. It's super rare, guys. The people that do survive usually get to a neurosurgeon quickly, and they usually don't live normal lives. So this is a really important thing to watch. As much as I think there's up to about 10 cases a year in the US as estimated, but it's not that rare. There's been 3 of them in North Idaho and Eastern Washington in about the last 15 years. There was one in Seattle about 2 years ago. So anyway, we want to make sure we are protecting folks from that. Almost all cases are under 21. We don't know why it doesn't happen to adults. Maybe because our brains shrink over time. There's more room. I don't know. And there's controversy about exactly why it happens. It's sort of like the CTE. But even people who kind of think that maybe it's some sort of separate entity all agree that a concussed brain is definitely more susceptible to a significant injury. So if you want to get back to sports, what are the requirements? You need to be fully asymptomatic. Your exam, including an in-depth neurologic exam, that means looking at the eyes, looking at your balance, looking at your cognitive skills, should all be normal. We do use impact testing in the schools, and your baseline is established for you, hopefully. You want to make sure that that impact test is reassuring. And if they're in school, the athlete should be performing at pre-injury levels. That's that return to learn part. Once the first 4 things are completed, then we basically take them through a graded progression of exertion over a few days. The trainers do that with our athletes in the schools. So basically, what is the progression? What are they going to be doing after they get that far? Usually after they've had 24 to 48 hours of symptom-free time, normal exam, and they're cleared, they'll the first day go to light aerobic exercise, second day kind of moderate aerobic exercise, and the third day higher intensity aerobic exercise. If they do well each of those days without a return of symptoms, then they go on to non-contact sport-specific drills and training. So it's not only getting them out there on the field again, but it's also making sure the cognitive end of things, like they remember what the plays are in football or what the rules of soccer are or such. If that all goes well, again, a day for each of these levels, then they have to have a full practice. That's kind of a mandatory thing throughout the sports world. Generally, in a full practice, your teammates don't want to hurt you, but sometimes the team from Boise might. So what we want to make sure is that you're going to tolerate sort of friendly contact before we put you in and make sure that doesn't cause a problem. If that's all good, you go to full competition. So additional points, if they do become symptomatic, I get this question a lot. Basically, we hold for 24 hours, we go back to the last asymptomatic stage. So in other words, if they're at high exertion when they have a problem, we wait a day, go back to moderate exertion, and then go forward again. So it's not like you start over. Anyway, we want to make sure that the impact test is cleared prior to any return to contact or full practice. So sometimes the trainers will start this process before people have completed their impact test. Anyway, we do have a clearance form that we try to get out to the schools. So if your child comes home with one of these, bring it to the visit with your doctor, whoever that might be. And it basically says that, kind of outlines the things that we just talked about and that everybody agrees, including the physician, that things are good. If anybody's interested, you can go into the Idaho statutes and read the concussion laws. It's 2 pages. So best prevention for serious injury is proper equipment, training, and technique. So listen to your coaches. And obviously, if you do get an injury, appropriate treatment when it does occur. So again, that little guy might prevent some bad things, but probably not a concussion if he goes for the cheese. And that's it. That's me trying to get through 15 minutes and taking probably 20 something. So sorry. Most of them are. Some of them have kind of gotten away from it. I think Sandpoint's not using it any longer. They're still using it down in St. Mary's. The three main high schools in Coeur d'Alene, including charter, are using them. Sometimes they're not doing every athlete. Some schools do more than others, but generally for sure the contact sports. You might know better than I do whether they're using them at Lakeland or Timberlake anymore.
I don't know if Lakeland School District is using them or not.
Anybody from Lakeland or Timberlake? Are they using them? Okay.
Coach basketball. So what I want to find out is there's a lot of stories about when you go to evaluate, let's say the kid hits the floor of the back of his head, to do a quick evaluation to kind of realize whether has an injury and whether he needs to be seen right away or maybe he can wait till later, see how things turn out. What would you say for a coach for a quick evaluation? What would be the steps you would suggest?
Well, what we usually talk about with our coaches is, obviously, hopefully you know the athletes pretty well. If you're seeing something that's got you concerned, if they're sluggish, if you think that maybe they're not responding as quickly as they should, if they're stumbling around, things we talked about, those are things we want you to pick up on. And again, those are athletes that should be pulled out. You can always figure out whether it's truly a concussion later if we have to. The big thing and a good question is sort of what do we do to make that decision? Do they need to go to the emergency room or can they stay at the game? Obviously, if they have symptoms that are really bugging them to be at the game, if it's not severe, we say, yeah, just go home with your parents and rest. Certainly see an emergency room or provider if there's a concern. There's certain things that you want to watch for. Obviously, deteriorating symptoms. So if neurologically they're doing well and all of a sudden they're getting worse, that's someone we want to see in the emergency room. If their headache becomes severe or worst headache of their life, lots of times we want to get those folks in. There's kind of an old rule that people who hit their head usually throw up once. We don't get too excited about that, but if people start throwing up, that probably should be evaluated, especially if it's repetitive, so more than once. If they stay nauseous, they keep throwing up. Certainly any progressive confusion, progressive disability in terms of walking or things, we should probably see them. A lot of times we'll see looping. I don't know if anybody's ever seen that in a concussion before, but the people ask the same 3 or 4 questions over and over and over and over. Probably a good idea they get checked out, but yeah. Kootenai does have their own kind of bank of tests, so to speak. So prior, like junior high and grades, well, you really can't get too young with them. Honestly, it's a tough test at 10. Really like 12 is probably the age where kids do the best with it, and it's a little bit more reliable. But you can give our office a call, and you don't need an appointment to see me or anything. You just schedule a baseline. I think Kootenai charges $10 for them. We have to pay as a healthcare institution for the tests. The schools all get a scholastic price, which is actually really good. They get a gazillion tests and post-injury tests. So that's really nice for any healthcare provider. If we purchase the tests, they're actually pretty costly. So I think they charge you what we pay for them, basically. But yeah, that can be done. And then so it's important to know too, tests are good for 2 years. So if you have a 12-year-old take it, certainly by 14 they should be doing it again. We look at it as sort of an opportunity to bridge between those pre-high school years. Once they get to high school, if they're in, it sounds like most of the school districts, like I said, with the exception of Sandpoint, they'll get a impact test there. And the nice thing is, you don't have to get injured in your sport to use it. So oftentimes we'll see somebody in the summer who had a water skiing accident or something, or a wakeboarding accident, who has an impact test because they played football. And so we'll use that. We'll make sure they get a post-injury test. So.